Good afternoon and welcome. Thank you for joining us for today's webinar, which is Uncovering America's Best Kept Secret, Family Resource Centers and Family Resource Center Networks. Thank you again for being here. My name is Julie Matusik, and I will be your presenter for today's webinar. If you are joining us online, you can listen directly through your computer speakers. And if you have joined us via the telephone number that Zoom has provided, your line has been muted to minimize background noise. So for those of you that are online, you'll see a link in the chat for the Dropbox folder by the end of today's webinar. And this is where you'll find the handouts. And I see it there now. So thank you so much, Cheryl. And in addition, you can put questions in the Q&A section at any time throughout the webinar. We'll use that like our parking lot. So please enter your questions as soon as you think of them. And in addition, we have the chat available for you to include any comments throughout the webinar, but we ask you to direct all of your questions to that Q&A section of Zoom. If you're having any tech issues or we have our live tech support here with us as well. So Cheryl will be available to help you if you're having any challenges accessing anything as well. And we will try our best to get to all of the questions at the end of the webinar. But if we are unable to, someone from the National Family Support Network will follow up with you after today's webinar. And also want to mention that today's PowerPoint, as well as the handouts and the recording of today's session, will be available on the National Network website on the Webinar Wednesday page by this time tomorrow afternoon. And also want to mention that when you exit today's webinar, an evaluation will automatically appear on your screen. So we ask that you take a moment to complete this as it provides us with valuable feedback to inform future webinars. So now we would love to get an idea of who is with us here today. So here you'll see we have divided the nation into regions. So take a look at the map and see which corner of the United States you are in. And there also will be an option for outside of the United States as well. We're going to launch a poll. So take a moment. Cheryl's going to launch that now, and take a moment to let us know which region you are in of the United States, or if you're from outside of the United States. And you'll note that we have included the United States territories as well. So take just another moment to respond to that poll. And great to see some of you have found the chat as well. Great to see you here today. All right, last 2 seconds to let us know where you're joining us from. And then Cheryl will close that poll out and share the results with us so we can see where you're all from. All right, love this. Looks like we have representation from across the country. So our strongest representation is from the West Coast. Thank you for joining us today, but we have great representation from the other regions as well. So great. So glad to have you here with us today. And the next question is about your affiliation. So we're going to launch a poll and learn a little bit about your affiliation. So are you working for a family support program, such as a family resource center? Are you working at the network level? And then we have government, and then we have government specifically focused in child welfare and private funder. And of course, the other is our catch-all. So let us know what your affiliation is. We'll give you 5 more seconds to respond, and then we'll share out those results. All righty, let's see. Awesome. We have all of these groups represented, but our strongest representation is from family support programs themselves. Very cool. Great. Great diversity here today. Wonderful. Great. Thank you so much. Alrighty, and our last poll question here is about your role. So once that launches, take a moment to share about what level you're working at. So are you at the program level? Sounds like we do have quite a few of you at the program level, but let's see what the results say here in a minute. And then we have management level. So maybe you're a CEO or director, or a coordinator, or maybe you're working at the policy systems level. It's very exciting too. So take a few more moments here. All right, let's see these results and see what we have here. It's very exciting. We have great diversity with the levels that are represented today as well. Awesome. Well, thank you so much for weighing in on these polls. It's great to learn a little bit about each of you that are here today at the webinar. All right, so let's dive in. And here on your slide, you'll see a roadmap of our time together today. So we're going to talk all about family resource centers and family resource center networks, and we'll share some information about the National Family Support Network, and we'll share some resources and opportunities that are available to you through the National Family Support Network. So let's dive in. So the concept of family support, dates back to the late 1800s with the creation of settlement houses in major metropolitan areas, such as New York, Boston, Chicago, and San Francisco. These settlement houses, they provided a large number of immigrants that were entering the country at that time with support and job training, English classes, and social advocacy as a means to assist them in understanding, adapting to, and succeeding in American society. So the slide that you see here on your screen, it illustrates the Good Samaritan Settlement House in San Francisco on the left back in 1913. And then on the right, you can see its modern look as the Good Samaritan Family Resource Center that continues to serve families today. So originally serving immigrants from Europe, the Good Samaritan has since evolved with the changing needs in the community and shifts in the neighborhood population into a family resource center that is serving largely the Latinx community. So thousands of family resource centers have emerged organically across the United States, and yet their existence, it is still largely under the radar as what we refer to as America's best kept secret. So a family resource center is a community or a school-based welcoming hub of support, services, and opportunities designed to support families to be strong and to be successful. The top image here on the left is from a community-based family resource center in Vermont. And the bottom right one is from a school-based family resource center in Kentucky. So FRCs, they work with families in an approach that is not only two generational, but multi-generational and also strengths-based and family-centered. So each of these concepts are really important. So let's talk about them individually here. So when we say multi-generational, maybe you have heard of 2-gen or two-generational work, which is great. But the family support field is the original, not just 2-gen work, but multi-generational work, as programs are working with children, they're working with parents and grandparents as well. And family resource centers are strengths-based because we see families as having strengths that we want to support them to build upon. And family resource centers are family-centered because everything we do with family resource centers has families at the center. And family resource centers are designed for all families, not only low income or highly challenged ones, So that way, the support is provided in a non-stigmatized way. And this is making it more readily accessible to everyone. So programming is provided at no cost or low cost for participants. The image that you see here on the slide is from a Family Success Center in New Jersey. And there are 57 Family Success Centers across all of the state's 21 counties. So each county has at least one and typically more than one Family Success Centers. So that includes highly affluent counties as well as highly challenged counties, because again, the belief is that all families can benefit from accessing the support for two of the most important jobs that we can have as adults: being parents and being spouses or partners. So these are two of the most important jobs that we can have. And so we typically receive little or no support or training for these roles that we have. So hence the value of universal access to family resource centers. So you'll see here on the slide, these are the Strengthening Families Protective Factor Framework. And curious to learn a little bit about whether you've heard of these before today. So let's take a second to launch a poll and hear if you have heard of this framework prior to today. So how familiar were you prior to today's webinar with this protective factor framework? Have a bit of a spectrum there. So not familiar, somewhat familiar, familiar, or very familiar. All right, take about 5 more seconds to let us know how familiar you are with this framework. Okay, let's see those results. Great. Well, we have the full spectrum represented here as well. Great. Very diverse group today. So for those of you that this is a review, wonderful. It'll be short and sweet. And for those of you that aren't as familiar, excited to orient you to these now. Thank you so much, Cheryl, for helping us with that poll. Alrighty, so this framework, it comes to us from the Center for the Study of Social Policy, and research has shown that these 5 protective factors increase family stability, enhance child development, and reduce the likelihood of child abuse and neglect. So as we are working with families, we want to support them to build their protective factors because we know that they can make a positive difference. So take a second to read over these protective factors. So they are parental resilience, social connections, concrete support in times of need, knowledge of parenting and child development, and the social and emotional competence of children. And if you'd like to learn more about this framework, you can go to the Center for the Study of Social Policy's website, which is linked there, but you also can just go to cssp.org and link directly to by clicking on the Strengthening Families tab. So encourage you to check that out after the webinar. So let's talk about family resource centers. So there is no dedicated federal funding for family resource centers, unlike Head Start, home visiting, or after school programs. Yet there are more than 3,000 of them across the country that are working with more than 2 million people annually, which is pretty incredible. So why are so many public and private funders at the state, county, city, and community levels choosing to invest in family resource centers? And that's because they are, simply put, just a good idea. And so they are cost effective. They are highly adaptable for various communities. So whether the community is urban, rural, or ethnic, and they have demonstrated successful outcomes through many multiple external evaluations. So definitely a good idea, and why we're here today, because we're excited to share this information with you. So as conveniently located hubs, they bundle, braid, and co-locate many services that may be familiar with you already. So visiting, evidence-based parent education, health screenings, playgroups, fatherhood programs, family counseling, and food banks. So family resource centers are shaped by the community. So they are by, of, and for the communities. And families are engaged in shaping the programs and services to be responsive to their interests and to their needs. So, staff are hired intentionally who represent the shared experiences and the diversities of the family served. And parent advisory committees, they impact program development and implementation. And this is because family resource centers are shaped by and responsive to their communities. So we often say if you've seen one family resource center, you've seen one family resource centers because they are reflective of their communities. So, all that being said, with them each being unique, at the same time, despite their organic development, there are remarkable similarities in their most common service areas. So, the data that you see here on the slide comes to us from a national study that was funded by the Robert Wood Johnson Foundation that the National Family Support Network worked with a research institute to conduct. So let's take a look at this. And these are the most common service areas of family resource centers. So we see the first one is parenting support. And so this exists on a continuum from lighter touch on the left to more intensive services on the right. So parenting workshops, definitely lighter touch, parenting support groups getting a bit more intensive. And then we have parent education series using an evidence-based curriculum. And then home visiting. Home visiting is the most intensive parenting support that is provided by family resource centers. And then we have access to resources. And again, this exists on a continuum from lighter touch on the left to more intensive services on the right. So enhanced information and referral, just being able to provide those resources as needed, and then concrete supports. So this is actually directly providing these concrete supports at the program. So maybe clothing, food, rental assistance, things like that, actually providing them at the Family Resource Center. And then working with families over time to address family identified goals. And then the co-location of resources is the most intensive way that family resource centers are providing access to resources. And then looking at the other most common service areas, we have child development activities are frequently seen at family resource centers, and parent leadership development is the other most common service area. All right, let's take a look at this next slide. So family resource centers not only provide programs that we just talked about, but they also build communities of peer support for families to develop social connections. And by doing this, they are reducing isolation and stress. And the isolation and stress are highly correlated with child abuse. And let's see here. And excited to share with you a testimonial that comes to us from a parent in upstate New York. And let's see here. Excited to share this perspective with you.
People underestimate how challenging it can be of trying to balance parenting and effective parenting, mind you, and not having a space to actually vent and communicate and learn alternate ways of rearing their children. People don't realize it is a support that they need, not once in a while, but like all the time. I could see the excitement, the smiles. It is the same every single time they walk in the door. The staff is so friendly, the space is so inviting. So it gives us an opportunity to just like kind of brush off life and then escape into this space where they could just relax, and it nourishes us, it feeds us, and allows us to just make, take all of that and positive energy and do life. Regardless of anyone's socioeconomic status, regardless of racial background, educational level, the need is exactly the same. It is a place, a need for a place to be able to sit down with other parents and do life together. And that is something that is so impactful. Once they have that support system in place, it has a ripple effect. And we will glean from that because our communities will thrive. The more support, I mean, it's just, it's like a domino effect.
I love that video. Every time I see it, I tear up because it just speaks to the value of our work and why we're here. So thank you so much for um, taking the time to watch that with us. So now that we have described family resource centers, Cheryl's going to launch a poll to ask you if you have seen programs that look like family resource centers in your state. And like we've said, sometimes they have different names, like we talked about family success centers in New Jersey. Sometimes they're not called family resource centers, but have you seen or does your state have programs that look like family resource centers? All right, take about 5 more seconds to let us know if you have seen programs that look like family resource centers in your state. All right, let's see those results. All right, great. It looks like about 2/3 of you have seen them and some of you haven't, and some of you aren't sure. And like we talked about, sometimes they are under the radar. So yeah, exactly. Great. Well, thank you so much for participating in that poll. It's great to learn a little bit about what your states look like and what you've had an opportunity to see. So two of the things that families have that were most sought out during the pandemic were parenting support and access to resources. And those happen to be the bread and butter of services of any family resource center, whether they are urban, rural, school-based, or community-based. So family resource centers more than rolled up their sleeves to help support families through the crises. And so these photos illustrate some of the support, some of the examples that happened across the country, and just a glimpse into the valuable work that family resource centers did over the pandemic. So there were infant supplies that were distributed in Colorado. There was a virtual bilingual story time that took place in Massachusetts. And then in Kentucky, there were school-based family resource centers that took on the delivery of free lunches to students while the schools themselves were closed. So just incredible examples of the valuable work that family resource centers were doing during the pandemic. And because of the Family Resource Center's strong response to support families through COVID, they are emerging from under the radar, which is so exciting. One of the good things that came out of the pandemic. So both in red and blue states alike across the country are committing new funds to support them. And you can see on the slide here some examples of that. So in Alabama in 2020, there was $3 million designated for family resource centers and added as a line item in the state budget for the very first time. And then in 2022, the state legislature nearly doubled family resource center funding in the general fund, which was incredible. And in California, $3 million was designated for emergency relief funds for family resource centers. They saw what they were doing, all of the valuable work that they were doing. And then family resource centers appeared in the governor's budget in that year as well and included $13 million in additional funds. And then in Colorado, they had a previous cut of $500,000 restored by the governor and state legislature. And then in Hawaii last year, they received $235,000 in federal governor's emergency education relief funds for family resource centers specifically. And then in 2022, new legislation passed. So it's incredible to see that family resource centers are emerging from underneath that radar. Yes. And then you can see here, this is another, some more examples that, make sure, yes, okay. You can see here some other examples of new investments in family resource centers from Kentucky and Maryland. They had a significant contribution in funds towards their network. And then in Nevada, they had over $1 million for FRCs for services and outreach to medically underserved populations that were affected by the pandemic. And Texas also recently had investments in family resource centers of $1 million to establish new family resource centers because they see the value of them. So it's so exciting because this slide wasn't there a couple years ago, and it's just incredible. All right, and this one, you can see Utah and Vermont and Washington State, just incredible investments made in family resource centers, becoming part of light items in the budget and state legislature seeing and valuing the incredible work. And so this slide was developed in partnership with Casey Family Programs, which is one of the National Family Support Network's partners and illustrates how family resource centers work with families across the continuum of potential involvement in the child welfare system. And this is also available for download on the website and is in the handout section that is in the chat. So here you can see we talk about investments and what an incredible investment family resource centers are. There's data to back that up. So the Alabama network completed a study to show how valuable family resource centers are. And they found that for every dollar invested in family resource centers, the state of Alabama received an immediate and long-term consequential financial benefits return of $4.93. So just incredible return on investment that Alabama was able to show. And this one comes to us, a similar study comes to us from the University of Chicago, conducted this study and found that neighborhoods with family resource centers had a 26% lower rate of child abuse and neglect investigations than similar neighborhoods without them. So again, incredible. And Teller County in Colorado, they are a semi-rural county outside of Colorado Springs. And so since their Human Service Agency moved to a differential response systems in 2016, referring screened out families to participate in Family Resource Center services on a voluntary basis. They have seen a 63% drop in their child abuse rates, and they only have one Family Resource Center. Yes, you heard me correctly. One Family Resource Center in their whole county. So think of not only the huge cost savings, but the human cost savings. So many families that are now spared entry into a highly traumatizing system that no family wants to have anything to do with. And once you're in, you may never get out of. And so Family Resource Centers, a little bit more data for you. This latest data comes to us from the research studies that were supported by Casey Family Programs that illustrate the specific child welfare system cost savings, both in semi-rural Teller County and in urban Orange County, California. So similar to the Alabama study that was referenced, for every dollar that is invested into Family Resource Center, there is an immediate return of investment in that. So seeing the savings there, both in Colorado and California in different settings. And if you're interested in learning more about the research that has been conducted, encourage you to check out the website and you'll be able to download these reports. So one other data point that we're excited to share with you is that in Colorado, families who participated in Family Resource Centers, they demonstrated statistically significant improvement in economic self-sufficiency. Their health was improved, concrete support in times of need, social support, family functioning and resiliency, and caregiver child nurturing and attachment. So just incredible, incredible results from Family Resource Centers. And Kentucky has also experienced significant gains because of Family Resource Centers. So in Kentucky, they've gone from they have over 800 Family Resource Centers, and by July 1st, they'll have 888 Family Resource Centers, all of which are school-based. They're the second largest network in the country, just behind California, and they have seen educational success gains and attainment since developing Family Resource Centers 30 years ago as part of their statewide education reform legislation. They also, as part of that, moved from 45th place in 1990 to being the top 15 school system in the country. So incredible, incredible gains there. So one question that comes up very regularly when we're talking about Family Resource Centers is, what does it cost to run a Family Resource Centers? And just to say up front, it does vary in relation to local cost of living, specific programming that they choose to offer or not offer, and the physical space that's being utilized. So some spaces are donated in kind, some are not. That's just an example. But we have on this slide, there's two examples that are outlined. So one is from New Jersey. So in New Jersey, they are community-based family success centers. And a typical typical family success center in New Jersey is has an annual budget of 240 to 300,000 that has 3 to 4 full-time staff as part of their program. And then in Kentucky, they have school-based Family Resource Centers, as we had shared, and they have an annual budget of around 33,000 up to 82,000, and that's with 1 to 2 full-time staff. And their space is in kind, provided in kind by the schools, and other resources are also provided in kind. So you can see that in kind makes a big difference in budget size. So these are just two examples, and like we said, if you've seen one family resource center, you've seen one family resource center, but wanted to share with you what it might cost to run a family resource center. And another frequently asked question about family resource centers is how they're funded. So many are funded by state, county, and municipal governments, and some leverage federal funding. So CBCAP funds, or community-based child abuse prevention funds, many leverage that. And there's others as well. So foundations, corporations, individual donors, in-kind support are also other ways that FRCs are funded. And also want to mention that many many leverage family resource centers to provide up to 12 months of in-home parent skill-based programs for parents or relatives caring for children who are candidates for foster care. So this is, if you've heard of the Family First Prevention Services Act, this is where that comes in. So leveraging family resource centers to receive that funding. And when we are talking about in-home, that means that the child has not been removed from their family, not that the services need to be provided in the home of the family. So just to clarify that, what that means. And family resource centers also provide programs on the Title IV-E prevention services, or Family First clearinghouse. So we listed some of them out here on the slide for you, such as Incredible Years, Healthy Families America, motivational interviewing, parents as teachers, or Triple P, using that clearinghouse. And also want to mention that families, family resource centers and Family First family resource centers can be leveraged to implement kinship navigator programs. And networks can also, networks of family resource centers can also support successful planning and implementation of the Family First prevention. So New Hampshire was actually the first state to leverage FRCs to implement kinship navigator programs. And if you're interested in learning more about that, you can go onto the website and listen to a webinar just about that, and talking about that with Families First. So we've talked about family resource centers. Now let's look one level up. We talk about how family resource centers are connected. And so not only have cities, counties, and states hit upon the value of family resource centers, but also they have hit upon the value of networking them together. And so family resource center networks, they consist of 2 or more family resource centers, and they ensure coordinated and quality support for families. And these networks, they serve as the backbone entity to leverage and to coordinate the collective impact of their members. So these networks, they may be an independent nonprofit coordinated by a public or private funder, or led by Family Resource Center directors themselves that are serving in a volunteer leadership capacity. On top of all of the things that they already are handling at a Family Resource Center, they're also volunteering to run a network. So those are the 3 type of Family Resource Center networks. And like we had shared the most common functions of family resource centers, we also are excited to share with you the most common functions of FRC networks. So they look different from network to network, but again, these are just the most common functions of the network. So this data again comes to us from the national study that the National Family Support Network worked with a research institute in Colorado on. So the most common functions of an FRC network are that they increase the connectedness and coordination and cooperation and collaboration amongst their members. So bringing them all together. They also regularly provide training and technical assistance for their network members. And they also work on advocacy, policy, and legislation. And they also provide and maintain a shared data tracking system. So not all networks do all of these things, but those are the most common functions of a Family Resource Center network. So when we talk about networks, we regularly define them in two ways. So the first is their stage of network development, and then the type of network that they are. So let's talk about the stage first. So we talk about these stages in being divided into three areas. So the emerging networks are kind of in that birth to 3 years. They're in their infancy. They're just getting started. They're determining who will be at the table, what they want to focus on. All of that planning is happening in those early stages. And as they're getting a little bit older in their toddler years, these evolving networks, they're continuing to develop. They may hire a contractor or maybe your first staff, and the networks are beginning to have more structure and capacity to do more. And then once a network is considered an established network and has been around for at least 5 years, they typically have staffing and have a track record for activities. And an interesting characteristic of these networks is that they have weathered crises together and they've decided to stick together. And then we talk about different types of networks. And at the bottom half of this slide, you'll see how we divide these up. So we just talked about these on the previous slide, but now you have a visual to accompany this. So volunteer coordinated networks are led by Family Resource Center directors themselves, such as, so these are volunteer capacity only, and the leadership of the network is voluntary without paid network staff. So West Virginia is a great example of this. And then we have funder coordinated networks. So funder coordinated networks are led by a public department or a foundation that both funds and convenes the centers. And Nevada is a great example of a funder coordinated network. And independent nonprofits. These types of networks are staffed. They're a staffed independent nonprofit organization that functions as a membership alliance with members paying dues. So these networks may raise and distribute funds. So maybe they're an intermediary, maybe they're not. So examples of this are Colorado and the Maryland network. And now looking one level up further from the networks of Family Resource Centers is the National Family Support Network. So we actually were co-founded by 8 states that you see green here on the map. And we were co-founded by these 8 states in 2011 as a membership organization. And for the first 4 years of our existence, the National Family Support Network had no paid staff, and the steering committee members, they coordinated the work of the National Family Support Network as volunteers on top of their jobs of running state networks. And over the last decade, the National Family Support Network has quadrupled in size to now having 39 member networks, the 38 states and the District of Columbia that represent more than 3,000 family resource centers that are serving more than 2 million people annually. And actually, we just heard hot off the press, it's not even in writing yet, but our most recent network to join just yesterday, we just heard from them, the state of Louisiana is joining the network. So very exciting. So we look forward to that whole map being green. And our mission is to promote positive outcomes for all children, families, and communities by leveraging the collective impact of state family resource center networks and championing the quality family support and strengthening practices and policies. And our vision, in short, is that it's about turning that whole map green. That way, we can ensure that all families have access to quality family support services in their very own communities that are provided by family resource centers that are supported by strong networks. And the National Family Support Network has divided its work into 3 buckets. The first is about connecting and convening member networks to enhance their effectiveness. So increasing the connectedness amongst members for peer learning and for mutual support. And the second is about promoting family support best practice and evaluation. So raising awareness of what quality family support is and promoting a common language, standards, and evaluation of it through the national implementation of the standards of quality for family strengthening and support. And the third bucket is raising the visibility of the value and impact of family resource centers and family resource center networks in order to strengthen and increase the support for families. And National Family Support Network membership. Let's talk about this for a minute. So the criteria for membership is having 2 or more family support and strengthening organizations that includes family resource centers coming together to form that network. And you can be at any stage of network development. We've had members join at all different stages. And there is just one network per state. So if you're in a state that already has a network, we would encourage you to connect with them and to join forces. And dues are intentionally kept very modest, and they cover the whole state. So regardless of if you have 2 family resource centers or whether you have 888 like Kentucky, regardless of the number of programs, your dues are the same. And dues are intentionally kept modest and affordable, and new member dues are most affordable that first year, intentionally keeping them lower. And they are prorated for volunteer coordinated networks versus other types of networks. And it also, the dues also includes one registration for the annual member convening for the National Family Support Network, which we actually just held this week. So let's talk about the standards. That was one of the areas of work of the National Family Support Network. And these standards, they are designed to be used by all stakeholders. So public departments, foundations, community-based organizations, and families coming together as a tool for planning, providing, and assessing quality practice. These standards, they uniquely integrate and operationalize 2 frameworks that come to us from our field, which are the principles of family support practice that came to us from Family Support America. So that organization has since sunset, but their framework continues to guide and frame our field today. And the Strengthening Families approach and its research-based, evidence-informed 5 protective factors, which we talked about earlier today. And so important to mention that these standards, they create a common language and expectations across different types of family strengthening programs. And so maybe you're in a family resource center, home visiting program, a child development program, regardless of which type of organization you're working for, the standards create a common language. So you can communicate like other fields do, like healthcare, government. There's all of these different fields that have a common language, and now our field does as well. And these standards, they also help ensure that families are supported through strengthened quality practice. And important to mention too, that we are not selling these standards. They are available to download for free. If you go to the National Family Support Network website, and if you hover over the standards and click drop down to overview, that page is where you can download the standards for free. You can check them out free of charge. You also can download all of the implementation tools. There's a suite of them. If you go to standards, hover over standards and drop down to standards and implementation page is where you'll be able to download all the standards implementation tools free of charge. And so when we're talking about these standards, it's important to mention too that they were recently revised in 2020. They were revised with an eye towards diversity, equity, and inclusion, and then were approved for national implementation in March of 2021. And so these standards, as part of that revision, in addition to being revised with an eye towards diversity, equity, and inclusion, they also were reviewed and revised for relevance for both the Canadian and United States context. And so the standards are divided into 5 core areas of practice. So you can see those areas here on the slide. So they are family centeredness, family strengthening, diversity, equity, and inclusion, community strengthening, and evaluation. And you can see here where the standards have gone over the past decade. It's incredible to see the growth on this map. We update this monthly, and it's on the website. You can check it out after today's webinar if you want to keep an eye on it, just where the standards are going. You'll note that there are states here that are blue on this map that aren't members of the National Family Support Network, and folks do not need to be in order to use the standards. And you can see here, we have trained well over 12,000 people across the country. There are well over 100 standards trainers that are currently conducting these standards trainings across the country. It's just incredible to see where they've been. And so the National Family Support Network worked with its members to develop a blueprint for how to scale family resource centers and family resource center networks to ensure that all families have access to quality family support and strengthening services. So the National Family Support Network publicly reports back on progress annually with a briefing in May. So if you want to check out this document, if you go to the NFSN website, and if you click on the events, hover over events and drop down to the national briefing, you'll be able to view this document, view recordings, and it was a wonderful event that was held in May. So since the beginning, when the idea started of the National Family Support Network, when the idea first emerged as an idea, the co-founders reached out to these organizations to see if they wanted to support and wanted to connect. So these entities, these organizations offered their support to the National Family Support Network. So take a look at this list. And so the United States Administration for Children, Youth, and Families is one of our national partners, as well as Casey Family Programs, the Center for the Study of Social Policy, Strengthening Families, the Children's Trust Fund Alliance, Families Canada, and the Friends National Resource Center for Community-Based Child Abuse Prevention, as well as Prevent Child Abuse America is our newest national partner. So these partners regularly participate in National Family Support Network activities, including serving on each other's committees and co-sponsoring events, as well as presenting at each other's events and working collaboratively on joint projects. And the National Family Support Network works collaboratively with many other organizations as well. So would love to pause to ask you to think about any questions that you may have. Feel free to put questions that you have into the Q&A section of the Zoom platform. And if you'd like to share any thoughts, if you want to share what resonated most with you from the information shared, what information you would be interested in exploring further, we would love to hear from you. And while you're doing that, I see we have some questions in the chat. So thank you so much for questions in the Q&A section. So thank you so much for entering those into there. I want to give everyone an opportunity to enter in your questions into the Q&A section. So while you're getting those thoughts in, want to share some resources that are available to you through the national network. So Webinar Wednesdays, you obviously found out about this one, and we are so glad you're here. And if you'd like to participate in future upcoming Webinar Wednesdays, we have one coming up the first week of July. We are going to talk all about the standards of quality for family strengthening and support. So if you want to learn more about that, check that out in July. You can go ahead and go to the website to register for that one. We also have recordings of this webinar. If you don't want to wait till July, you can also see recordings of where we had an opportunity to highlight different networks, and there's just a library, a wealth of information on the website. And we talked about the standards certification. We talked about the standards and how valuable the standards are, and you can certainly download them and start using them today. But one of the best ways to use the standards is to participate in a training. So if your state doesn't offer a standard certification training, if there's not trainers yet in your state, you can register for one of the open NFSN hosted certification trainings. And these are conducted virtually right now. So regardless of where you are, you can connect and join for the training. So registration for the July certification training is currently open. Registration for the August training will be opening shortly as well. Another training that we are excited to highlight and share with you is the Developing and Sustaining Effective Parent Advisory Committee training. So we talked about the importance of having parents at the table. Well, this training lets us know how we can do so formally. And so whether you are starting a new parent advisory committee or whether you're wanting to strengthen an existing one, you can just really, this training is a wonderful training to learn how to do these things concretely and get going. This is co-trained by a NFSN staff member as well as an experienced national parent leader. And the Together for Families conference, we're so excited to share that registration is open for the Together for Families conference, and early bird registration is open through July 31st. This is our big tent conference. It's for everyone, regardless of your level. If you click on if you go to the Together for Families website, it's here at the bottom of this page, or if you're already on the NFSN website, if you want to link to it, you can click on events, hover over events and drop down, and it'll take you to the Together for Families website. And you can check out on the website the presenters, who the plenaries are, what the sessions are. We have different tracks. It's going to be an incredible conference. And we had previously been in person. We hosted the very first Together for Families conference in Ohio, and it was just wonderful. And it's been great since we've been virtual that everyone is able to participate without the barrier of travel. So very excited for this coming up in October. And also want to share these resources with you as well. We have some different resources here that are on the slide. So the first is highlighting just everything that's on the website. There's so much there. There's Family Resource Center overviews, research reports, sample requests for proposals, evaluation plans, videos, tons of information about data management systems. Member network snapshots were updated this year. And so there's a sample of one that you can see on the right side of the slide. It's a great document where you can see at a glance what each of the networks are up to. You can see what types of networks each of the networks are, when they were founded, what their service areas are, things like that. So high level of each of our networks. So check that out. They are, if you go to the website, if you're on the website and click About Us and drop down to Members, you can click on the snapshot document from there. We also have many network development tools available to you, including a network development continuum and a continuum that is just for funders. So funders that are interested in starting networks. And of course, all of the standards, implementation tools, there's tons of things about the standards on the website as well. And we also can help facilitate connections to member networks. So feel free to reach out to us. We can also present to key stakeholders. So whether it be educational leaders, child welfare leaders, children's trust funds, and any other public and private funders about working with and investing in family resource centers, we're super happy to make connections and present some of the information we shared today. We also are happy to help explore network development. So would love to connect with you if you have questions about developing a network in your state. We can also work with you to provide trainings, the standards training and the parent advisory committee trainings. Happy to bring those to your state. And if you are interested in learning more about developing a network or have questions, we're definitely going to be answering questions here in a moment. But if you have any beyond today, feel free to take note of my colleagues' contact information. They're also on the website too. Our co-founder and director, Andrew, and my colleague, Jennifer, who you would contact about anything membership and events related. And I will leave this slide up for you while we are answering questions. So let's dive into questions. Thank you for entering these in and excited to start answering these. So there's a question in here about can we expand upon the when we talked about co-location of resources? And absolutely. So when we were talking about family resource centers and the one of the most common service areas, and that we were talking about that, we talked about the co-location of resources being an intensive way that family resource centers are providing services. So what this means is, and it looks different from family resource center to family resource center, but an example of this would be having childcare resource and referral right in-house at the family resource center, having a WIC program right in-house at the family resource center, maybe having a food bank right, a food pantry right on in-house at the family resource center. So what the resources are varies from family resource center to family resource center, but that's an example of co-location of resources. And I hope that answered your question. And to answer your question about, will this be recorded? Absolutely. It is going to be on the website tomorrow afternoon around the same time. So definitely can check it out there, and definitely share with your colleagues as well. Let's see here. And there's a question about how with family resource centers, how to go about moving forward with family resource centers. I think what you mean is around developing a family resource center. And so we definitely encourage you to connect to us. You can reach out to Jennifer to learn more about kind of where to start. We have tons of information on the website as well, as far as what family resource centers look like in different locations. So encourage you to both connect with us and to check out the website. We're also in the process of developing a family resource center learning hub where you can actually learn where to start. And we're super excited to launch that shortly. And if I hope I answered your question, but if not, definitely reach out and let us know. Let's see here. And there is a question about the differences between a family resource center and a family support center. That's a great question. So the short answer is they just are different names. So different states often have different names for them because, like we talked about, these were, these many of them, they originated organically. And so, someone, in New York State, which is where I am, they had this idea of like, we can help families and we can provide services and resources. Let's call it a family resource center. And then someone in New Jersey had the same idea and they wanted to call theirs a family support center or a family success center. They're different from state to state. I know in Illinois, they have a different name. And so they're called different things because they did emerge organically, but it's been an incredible opportunity to see them connect across the country, despite having different names, because they do have a lot of those same most common service areas, even though they're also different at the same time. All right. And I think that's the end of our questions today. And I'm sorry, there's a question here about some of the innovative ways that you've seen these implemented across across the country to support families. I would actually, I can't cover them all, I just can't list them all. And I don't want to leave any out, but one of the places I would encourage you to take a look is on the website in the Webinar Wednesday tab. There is, there's at least one webinar, if not two, about family resource centers in unique settings. So check that one out. There's one that we hosted specifically about co-locating with a library and how that was done. That was super innovative as well. So I hope I answered your question, Sarah. And if you have more questions, definitely don't hesitate to reach out. We would love to connect with you. And as a reminder, when you leave the webinar today, you will have that survey pop up. We appreciate you taking the time to complete it. We read every word, promise, and we really appreciate it. It helps inform future webinars. So thank you again so much. And Cheryl has also put in the chat box the link to the Dropbox folder, which contains the handouts for today's webinar. So definitely check those out. And thank you again for the opportunity to meet with you and share some information. And hope you all have a wonderful rest of your Wednesday. Thank you so much.